A very good evening to all my viewers. I'm Dr. Sonali Jagati, OBG resident at SCBMCH Cuttack, Odisha. On the occasion of World Health Day, today I have brought a video mainly highlighting on this year's theme, that is Healthy Beginnings, Hopeful Future. Now this year's theme has been mainly being focused on the maternal health and the health of the baby. As obstetricians and gynecologists play a crucial role in helping develop the health of mother and the fetus, which ultimately gives rise to a healthy baby and healthy community. With this background, let's start today's session. So first of all, as we all know, prevention is better than cure. So the best time to counsel a lady in reproductive age group regarding the do's and don'ts during her pregnancy is her preconceptional period. Yes, before she conceives preconceptionally, she must visit an obstetrician, consult, do the recommended tests which will help in diagnosing some of the diseases which were not detected earlier. Also, during the preconceptional time, the obstetrician will help in guiding her the right kind of diet, exercise, which will help in optimizing her weight and bringing the right BMI. Also, she has to take certain medication like folic acid, which is very important. The ideal time to start folic acid is minimum 3 months before conception. Obviously, it is difficult and unpredictable practically. So at least 4 weeks before she's trying to conceive, she should start folic acid. Now this helps in preventing neural tube defect in the fetus and also helps in preventing megaloblastic anemia due to folic acid deficiency in mother. So once she becomes pregnant, she should visit the healthcare facility. So in this regard, the Government of India has categorically mentioned the minimum number of antenatal visits is 4, whereas the WHO gives the guideline that 8 antenatal visits must be done. WHO also calls it as antenatal care contact. Remember that these are the minimum number. When Government of India tells 4 visits, they have told that within 12 weeks of her pregnancy, she should be booked and registered. From 14 to 26 weeks onwards, there should be 1 visit. 28 to 32 weeks, 2nd visit, and the third visit, and 36 weeks to term should be the 4th visit. When WHO tells 8 antenatal care contacts, they have told 1 visit in the first trimester, 2 visits in the second trimester, and 5 visits in the third trimester. Remember that when it comes to the recommendations, it should be 13 to 14 antenatal visits are recommended. That is, up to 7 months we advise the lady to come for a monthly checkup. On the 8th month, she should come 2 times per month. And then every week she should come at the 9th month till delivery. In every antenatal visit, it is very important that we check her weight. This will help us in keeping a track on her weight gain. Obviously, her vitals will be recorded. Any complaints that she has, everything must be discussed. In this regard, the very important thing to understand is the investigation. When a lady presents to us in her first antenatal visit, we advise her certain investigations. That is, first is CBC, that is complete blood count. This will help us in knowing her hemoglobin status. As we all know, anemia is a very prevalent disease in our country, for which Government of India has taken a lot of initiatives and health programs like Anemia Mukt Bharat, National Iron Plus Initiative programs. So hemoglobin status has to be known, thyroid profile has to be done, 2 hour 75 gram GCT, that is to know her diabetic status, or also known as oral glucose tolerance test. Urine routine microscopy to rule out any urinary tract infection. Blood grouping and RH typing is advised to know any RH negative mother, which is again a high risk pregnancy. VDRL testing is done to check for syphilis. Obviously, the ultrasound scan should be done. The first scan is called as the dating scan, which also talks about where exactly is the location of the fetus, whether it is intrauterine or vaccination is very important. See, she has to take a Tdap vaccine. Also, whenever the lady presents, it is important that her queries are also counseled, because she might have queries regarding her diet, what sort of exercise, whether she can travel if she's a working woman, and then certain personal questions like if she can have sex during pregnancy. Of course, she can have sex during pregnancy. What we recommend is that to avoid during the first trimester and last 6 weeks before delivery. Of course, every patient must consult their obstetrician, because whatever is their high risk condition, depending on that, their obstetrician will advise regarding sex to have or no. Important is the nutrition part. She should be advised to take lots of fruits and vegetables which are rich in vitamins, minerals, iron content. Supplements are given during pregnancy. So the first 3 months, that is up to the 12 weeks, we give folic acid. As I told you, the best time to start is preconception, but after that also she has to continue up to the first 12 weeks. Folic acid is given as 400 micrograms, and if she has any history of previous neural tube defects in the fetus, then she will be given 4 milligrams. From the 4th month onwards, we'll be adding iron with it. So iron and folic acid combination tablet is given, which she has to take for completely during her pregnancy, and after delivery also she has to continue it for minimum 6 months. Calcium tablet is also given 1 milligram. It comes in 500 milligrams. She can take 2 tablets per day. Very importantly, she must be advised regarding any ominous sign that she has or she develops, and when she should immediately seek medical attention. So these things has to be explained to the mother in every antenatal visit, so that if she feels any of these coming in presenting, she will immediately report to the doctor or the nearest healthcare facility. So I hope in a nutshell I have able to tell you in what is the importance of antenatal visit, what is the importance of preconceptional care. Thank you and have a great day.